Chapter 3, April 17th, 1917, early afternoon. Dr. Harvey laid the boy on the exam table in his office. The suite consisted of an entry room where patients registered with his assistant, Margaret May, who preferred to be called May, a small room with a microscope, some medications and reference textbooks, a larger room for patient examination. May helped remove the blood-stained blanket and glanced at Dr. Harvey, who said, "Please take Mrs. Swenson to the entry area and give her some water and a wet towel to cool her face." Using scissors, he cut the boy's right trouser leg to view the wound more completely. A jagged-edged laceration began a few inches above the ankle and extended upward about 5 inches on the right side of the leg. Raymond was pale and moaned when Dr. Harvey began to explore and clean the wound. No bone was visible. Despite the swollen tissue, he palpated the area of the fracture of the tibia above the ankle. May returned to the exam room and placed 2 basins filled with warm water beside the table. Dr. Harvey used the water to clean the skin and irrigate the wound profusely. He knew this open wound was a high risk for infection, and further irrigated the wound with a solution of peroxide. For a moment he wished he had access to X-ray equipment, but quickly resolved to set the fracture as carefully as he could. He asked May to bring a container of chloroform from the medication cabinet. He placed his hand on Raymond's shoulder and said, "You are a strong lad. I want you to count backwards from 10 while I hold this cloth near your nose. It will help you rest. When you wake up, you may feel some pain where I set your bone." Raymond was already unconscious. After he aligned the ends of the tibia as closely as he could discern by careful palpation, he approximated the skin wound edges and inserted several stitches. He cleaned the skin around the wound again and placed a bandage. Now he could apply a splint from above the knee to below the ankle, leaving just enough access to the wound site so it could be cleaned and newly bandaged at intervals. Before beginning the splint placement, he said to May, "Please go and reassure Mrs. Swenson. Her son is resting now, but it will be a few more minutes before he can be moved. Ask her if she knows someone in town with whom she could stay for several days, so we can monitor the wound healing and keep the area clean while it heals." May went into the entry area, and Dr. Harvey took a deep breath. He looked at the framed diploma mounted on the wall near the exam table. It read, "Northwestern University School of Medicine awards the degree of Doctor of Medicine to Kelly K. Harvey, this 13th day of May, 1913. He had not completed medical education until he was 28 years of age. Following college graduation from the University of Illinois in 1906, he had returned to his family's farm. His father had died months before. A wagon loaded with hay tipped onto him while he had tried to keep it upright on a sharply sloped area on the field. His mother died almost exactly 1 year later of tuberculosis. With his older brother, he had kept the farm in operation and also had worked as an assistant to a local veterinarian. The latter work had sparked his interest in medical practice. After his brother married and brought his wife to live in the family's farmhouse, Kelly, who had never aspired to be a farmer, resolved to pursue medical training. He thought back to Chicago and Northwestern, where he studied for 3 years before completing an internship in 1914. He recalled anatomy, physiology, and pathology courses. How he had loved learning to practice medicine from mentors such as a surgeon who taught him how to set bones and stitch wounds, and the importance of keeping wounds clean. The surgeon had guided him in the care of a young woman with a leg fracture at a hospital in downtown Chicago. The young woman insisted she had fallen while walking down a flight of stairs in the building where she lived, but Dr. Harvey had doubts about the story. The bruises on her face, neck, and arms did not seem to him likely to occur from a fall down the stairs. The nurses at the hospital told him they had seen the young woman before with similar bruises. Each time the woman had been seen, she told of an accident and declined offers to find a safe place to stay. She remained in the hospital for 2 days after Dr. Harvey set the fracture. But when she left with her leg in a cast, she was accompanied by a man who seemed quite unsympathetic and scolded her for leaving him alone. One nurse had told Dr. Harvey, "She'll be back if she lives through the next beating. We can't convince her to leave him because she sees no alternative." This had troubled Dr. Harvey ever since. After his internship, he had joined the established medical practice of physician in town about a 2-hour train ride northwest of Chicago. Soon he was seeing more than 10 patients daily, including railroad workers who were based there. His physician partner had a contract with the Chicago-Milwaukee-St. Paul Railroad Company, known by many as the Milwaukee Road, to provide medical care to company workers. Dr. Harvey had seen some of these workers now and then when his partner was not available. One day at the medical office, he had been introduced to Marie, a lovely young woman whose sparkling eyes entranced him and whose littling voice enticed him to ask her one question after another so he could hear the voice again and again. Marie had brought a sack lunch to her sister, who was an office assistant at the medical practice. She had continued to bring lunches for her sister and to take lunchtime walks with Dr. Harvey. Before long, Marie and Dr. Harvey were together for picnics, evening walks, and concerts at the town park. By Easter 1915, they were having dinner with Marie's family. That summer, he had asked her to marry him. When she said yes, his heart was pounding. Never before had he felt more anticipation or more optimism for the future. They were married in July. In December, when she told him she had missed her period for the second consecutive month, he held her tightly and felt an overwhelming sense of wonder and expectation. During the winter, as Marie became more obviously pregnant, they were cheerful, their interactions loving, and their talk all about life with the child. But in June, she had begun complaining of severe headaches. Her blood pressure had climbed, her kidneys produced little urine, and she had been admitted severely ill to the hospital. He had canceled all patient appointments in order to sit at her bedside day and night for 3 days. She became less and less responsive. Then the obstetrician caring for her told him little more could be done. He should pray and hope for the best. He was dazed. How could this be? How could he know so little, do so little? How could medicine have nothing more to offer? Marie died on the 4th day in the hospital. The boy fetus, 8 months in gestation, also died. Dr. Harvey was devastated. The funeral was a blur. He began seeing patients again at the medical practice, but he had to force himself to get out of bed each morning, to concentrate on stories his patients shared about their own illnesses. He had no appetite, no energy. He knew he was deep in grief. He wanted to mourn somewhere else, some place where everything he saw did not remind him of Marie. His physician partner had been supportive, but increasingly concerned as the summer weeks of 1916 went by. He sensed Dr. Harvey wanted to be somewhere else. In mid-November, he said, "Kelly, I'm going to mention something to you, and I don't want you to feel I am encouraging you to take any action. I'm just sharing information." Dr. Harvey looked at his partner for a minute and then replied, "All right, although your tone sounds ominous." "Well," said his partner, "a colleague of mine from medical school days has been in practice in Montana for a number of years. He's happy there, even served as mayor of the small town for a time. He recently joined the Army Medical Corps, and the Army may be sending him to a military hospital assignment. Seems some think we might get more involved in that European war before long. Now here's what I want to mention to you. My colleague is looking for a physician who can take over his practice for a while. There's no way to know how long the Army might keep him busy, but he tells me the town could use another physician in any event. So even after he returns, there'll be plenty of medicine to practice." Dr. Harvey was intrigued by the situation. He imagined practicing in a new place without making a long-term commitment, yet still have the possibility of establishing his own practice in time. "So you are not encouraging me to take any action, but you are just sharing this information with me?" His partner replied, "Yes, although I think you would be an excellent candidate to do something like this, and it might be good for you to spend some time away from here for a while. Of course, you would always be welcome to return." Dr. Harvey continued to imagine practicing in a new setting. Many questions came to his mind. Were there other physicians in the town? Was there a hospital? Where was this town anyway? He responded, "Thank you for mentioning this. I'd like to learn more." Now he was in Montana, placing a splint on a young boy's fractured leg. This young boy and many others in Forsyth, including workers for both the Milwaukee Road and the Northern Pacific Railroad companies, relied on him to diagnose and treat their ailments. ease their suffering, and share their aspirations, while he continued to deal with his own deep loss. He was carrying on.